Oh, wait. I'm not supposed to be sleeping right now. But you know what? Some people are asleep. How many surgeries is it actually going to take before you wake up and stop agreeing to have surgery for your strabismus? Well, thanks to my fuzzy jacket for helping me pretend to be my pillow. Time to wake up. Let's talk about how many surgeries will it take before you actually say no. I'm Dr. Julie Steinhauer. My clinic is Vision for Life and Success, and if you're local to us, you can call us at 618-288-1489. If you're not local, that's okay. We can still help. Go to our website at visionforlifeworks.com and schedule a consultation with me. Now, how many surgeries will it take before you say no for yourself or your child? Did you know on average, if you have esotropia, which is an eye turn in, or an eye turn out called exotropia, it's usually somewhere around 3 to 5 surgeries that are needed to gain alignment of the eyes and good binocular function? Wait a minute, I said something wrong. I said good binocular function. No, that's actually just to try and get your eyes cosmetically aligned. That has nothing to do with binocular function, because just aligning your eyes with surgery is not actually going to tell your brain what to do with your eyes. So will you say yes to number 2, 3, 4, 5, 6, maybe 7 surgeries before things are aligned? You know, to a lot of us, when we say that, that just sounds silly. But I have to tell you, so many patients come to us and they've trusted the doctor to tell them what to do. And they've gone through 3, 4, 5, 6, even 7 surgeries for their strabismus. And they still don't have eye alignment with their eyes. Now that's really tricky, because the problem is after more surgeries, well, we run a lot of risks here. One is that the eyes can be turning in the opposite direction. You may have gone in with an esotropia and walked out with an exotropia, or over time it developed into an exotropia, or you may have gone in with an exotropia and now you've got a hypertropia, or even a cyclotropia where the eye is tilted. So much crazy stuff can happen. And it doesn't mean that surgery won't work for a select few, but do you know how many people I've actually recommended have strabismus surgery since about 2001 when I graduated and became a doctor? Less than 10. I've seen thousands of patients, and I don't really recommend it, primarily because I feel like we can correct it through easier methods like syntonics and electrically triggering your brain how to use your 2 eyes together. So why on earth do we need to go through a surgery that either is going to detach the muscle off of the eye and reattach it in a different spot, or cut, like a resection of the muscle, and then put it back together in order to try and achieve alignment? What if we just electrically trigger the brain and the eyes to work together and to line up? Now that's actually what syntonics or photo light therapy does. When you take off your glasses and you put on a pair of, which ones do I have? Let's see if I can grab one. Here we go. Let's just use these. This one is for exotropia. And you put the glasses on. What you're doing while you're staring at a light is you're electrically triggering the brain to send a signal to the muscles of the eyes to line up. If you have an exotropia, then it's designed to pull the eyes into alignment. If you have an esotropia, whatever filter we use, which is, it's a green one actually, is designed to pull the eyes out into line up. If you have a hypertropia or a hypotropia, we're using a filter that's designed to get the eyes to line up and down. If you have a cyclo, well then it's a combination of everything I just said. So how many surgeries will you actually agree to before you stop and think that there might be another option? In fact, it might be not necessarily easier, but certainly more effective long-term for you. Because our goal with vision therapy is not only to treat your strabismus while you're in our program, but to get you to have success long-term. And that means by the end of our program, we have to give you activities to continue to work on. It's a maintenance program. It's almost just like whenever you go to the orthodontist and you wear braces. I've done that. And at the end, you have to wear a retainer in order to maintain the alignment of your teeth. Well, at the end of vision therapy, you better be doing some activities in order to maintain the alignment of your eyes and some of those really positive results you got. So at the end, we've got to give you a program of things to continue to work on so you can continue to keep your eye alignment. Because after all, just like with braces and teeth, you know, I don't stop chewing, talking, smiling, frowning, whistling, whatever it is that I do, and it affects my teeth, right? So if I'm gritting my teeth, that affects my teeth. And so the alignment of my teeth can kind of get off again. So if I'm not being mindful and wearing my retainer at night, well, I'm going to probably have problems with my teeth alignment again. And the same thing goes with vision. If we've aligned your eyes because you had strabismus before, you have to do some maintenance therapy even down the road. And that's just usually something about 15 to 20 minutes once a month, depending upon how severe your case is. But those activities once a month are really like putting in your retainer to maintain the alignment of your teeth, but now we're maintaining the alignment of your eyes. Because after all, just like with teeth and chewing and smiling and whistling and gritting my teeth, or I don't know, clucking like a chicken. Wait, what? Just like that, with our vision, we do lots of things, right? What we do is we're looking from distance to near and back and forth. We're looking off to the sides. We're looking up above, down below, up at angles. We're doing all kinds of things. We're looking at our, watches. We might be looking at our smartphone. We might be looking at a tablet. We might be writing a paper or reading a book, but we're doing all kinds of things with our vision. And so just like we don't stop doing visual activities, we don't stop chewing or moving our mouth, we have to do some level of maintenance for both. So at the end of our program, we're working on, well, what do you need to do in order to maintain the alignment of your eyes? Now think about it this way. Let's say that you go get surgery, and then you have to have 5, 6, or 7 surgeries. And by the way, you still have not achieved binocular vision because that's something the brain needs to be trained to do. But instead, let's say that you go through vision therapy, and the price to pay at the end is that you have to do activities once a month, 15 to 20 minutes, but you'll never need surgery again, or ever in the first place. You'll have binocular alignment with your eyes, two-eyed usage. Does that make sense? Two-eyed usage, good binocularity and depth perception, and many surgeries, possible complications, possibly the eye turning worse or different, or can't be fixed, and double vision permanently for the rest of your life, or vision therapy utilizing syntonics, and phase 2, which is hands-on therapy with a maintenance program at the end where you control it, you maintain good alignment of the eyes, so you have depth perception, great binocularity, and don't need surgery. Do you need to contact us? If you have strabismus and you've been waging that battle of multiple surgeries, it's time to put a stop to it. Wake up. Don't keep sleeping. Stop getting the surgeries. And if you're thinking about surgery for the first time, hit a pause. Hit a pause and connect us. If you're local, call us at 618-288-1489. If you're not local, then go to our website, visionforlifeworks.com, and schedule a consultation by clicking a button. If you like this video, hit the like button. If you haven't done so already, please subscribe to our channel, and definitely, this is one of those videos, pass it on. I guarantee you know someone or know of someone who knows someone who probably had strabismus surgery at certain points in their life, or possibly are thinking about having it. Pass this video on. Thank you.